Are you tired of walking around looking tired? No matter what you do, you putting on, your eye creams, your concealer, you're drinking water, you're working out, and you just can't seem to get rid of that pesky dip underneath your eye, aka eye bag. But I'm here to tell you that there's something that you can do. There is a thing, and it's called tear trough filler. Not everybody's a candidate for it, so I just want to take my time today and explain what a tear trough filler is, who's a good candidate for it, how long does it last, how much does it cost, all the questions that you have, I'm here to answer. So let's get started. Number one, what is a tear trough filler? A tear trough filler is more than likely a hyaluronic acid filler that is about 1 to 2 mLs, mostly 1 ml, which we decide when you do a consultation how much volume you need. But it's a sugar-based molecule that we have naturally occurring in our bodies, and putting a little dose underneath the eye goes a long way. One of the things about hyaluronic acid is that it is very water-loving, and so one of the good things about doing tear trough fillers is it does provide a little hydration underneath the eye, causing you a more rested look. Another great thing is, in the event that you decide that you don't want any under eye filler, it can be dissolved with the reversant called Hyaluronics. Once again, it is a hyaluronic acid filler more than likely, unless sometimes if the tear trough filler is a little deep, we do have to use sometimes sheet filler or some Sculptra, which is a collagen builder that we'll talk about in a different time. But if it's just tear trough, if it's just groove here, then you can do a little filler to call it a day. So there's different brands, different consistencies. There's Restylane, there's Juvederm, there's Versa, there's RHA. So there's a slew of them, and it just depends on the consistency that you need. But most of the time underneath the eye is a very delicate area, and you have to go with something relatively thin so that you're not able to see it. So in an event that you see it, it can cause even further bagging, causing you to look more puffy, and then you can see it pretty close and personal. So you've probably seen some people with fillers and kind of stick out, so you don't have to be that person. Make sure that whenever you do get your fillers done, hopefully you're getting them done with me, that you go to a reputable injector that knows the different consistencies along with your skin texture, and make sure that they're choosing the right one for you. Hyaluronic acid fillers cool in water, cause hydration. They're pretty safe, they can be dissolved, and let's get down to the other part. How long does it take to install? You're going to be looking at about an hour, good time hour to get your under eye fillers done. There's a numbing process, and then we want to make sure that you're comfortable and that you have been well informed of what to expect before, during, and after the fillers. So just want to take a huge hour chunk of your day to get it done. Most facilities will allow you to have a consultation and procedure the same day, but if not, 15-20 minute consultation, 1 hour install. What to expect during the fillers? There's not a lot of discomfort with the way that I place my tear trough fillers. I can't speak for all other providers. Tear trough fillers can be done with a cannula. A cannula is a blunt tip that allows you to go underneath the skin without a needle, so you do less damage to the tissues, blood vessels, and less bruising. It allows you to disperse the product a little bit more, without clumping, and so it's a lot better than doing the needle. However, if you have a needle insertion, sometimes that can be done as well without providing a lot of discomfort. So you probably will have some numbing cream involved or some injectable lidocaine involved as well. And also the filler itself has hyaluronic acid mixed with lidocaine with it. And so you will have some furthering numbing after the procedure has started, and it takes about an hour for it to go away completely. Pretty much that's during the process of it. So what to expect right after? Right after, you're gonna have a little bit of some tenderness. You're gonna have a little bit of swelling. The swelling itself probably will take about 4 days for it to go down. And when I say go down, I don't mean 100%. I mean to the part where you're not looking puffier than what you came in. as a point what I'm saying, hyaluronic acid does pull in water, but with any needle injection, you're going to experience a little bit of swelling because your body is a healer. And so as soon as you're poked with the needle, you're going to have platelets, white blood cells, plasma, growth factors that go right to that area and says, heal me, heal me, heal me. So with that being said, you're going to have an initial swelling phase that'll last about 2 to 3 days, which is normal with any injections that you have, even if it's not filler. So allow yourself, I would say if you have an event, I would allow at least 2 to 3 weeks before an event just to anticipate those changes, but they're very concealable. You know, you can get away with icing for a little bit. After 24 hours, you can take in some anti-inflammatories that do kind of help with the additional swelling, but it's just best to leave it alone, let it do what it do. Also, if you cut back on your activities that increase blood flow, like working out, also drinking, different things like that, anything that you can do to minimize stress to the body will also help you with the swelling. So anticipate swelling. You may have some pinpoint bruising. More than likely, if a cannula is being used, you're not going to have a lot of bruising. You're just going to have like just a little pinpoint from the area where the cannula went in. But if you have a needle, once again, the needle goes in sharp and it hits right down through the tissues, then you're going to typically have a little bit more increase in bruising. So bruising itself can last up to 7 days, depending on you and your body and your metabolism and how fast kind of break the hemolysis down, but you can anticipate that as well. There's some things that you can do. You can take arnica tablets a couple of days before your procedure, which is proven to kind of decrease bruising and swelling. And then you can also use arnica gel days after to kind of just apply on nice and after your procedure is done. But once again, anticipate bruising, swelling. Infection, not so much. You basically you need to know that these products are sterile as they're going in. You should be getting wiped down with alcohol, HIPAA, some type of antiseptic prior to your procedure, and then gloves, of course, should be worn. So your infection risk is way, way low. In an event that there is a reaction, more than likely your reaction will be prompt. So if you're in the chair and your injector noticed some blanching, meaning your skin color looks a little different, breakouts, or like patches or anything like that, then they can make a call to go ahead and dissolve the filler immediately. And this is something not to be alarmed at, but it's something that we are definitely as healthcare providers able to quickly react to, so you should not be scared about having reactions like that. Yeah, so the swelling, bruising is very common after tear trough fillers. Okay, this period of recovery is normally 2 weeks. At 2 weeks, you should expect a 2-week follow-up. A 2-week follow-up is just to ensure 1, that you're happy, 2, your results are good, and 3, there might be next steps that need to be made. Just because filler is placed underneath the eye does not mean that your under eye bag is going to go away immediately. Sometimes there's color changes that need to happen over time, like some vitamin C serums need to be added. Sometimes topical hyaluronic acid needs to be used. Sometimes also we may need to add just a better skin regimen in general. Sometimes exfoliation needs to happen. Definitely want to combine things in order to get the best out of your results. So expect to be asked questions about what is your skincare regimen? What are you doing on a daily basis? Are you drinking water? These are the things that help your fillers, one, last longer and help you look better and brighter and give you to the destination that you need to get to. Cost varies depending on supplies. I can give you a general average. You're probably going to spend anywhere from the $700 range to the $2,000 range, depending on who's doing them and depending on how much filler that you need. And this is also taking out whether or not you need your cheeks fixed. And I know we're not talking about the cheeks, but the cheeks are right here proximal to the tear trough. And if you have a lot of volume loss on your cheekbone, cheek pad, fat pad, sometimes this has to be replaced before you can do the under eye. And so that can really, really get the cost up there, because if we're talking about filler, we're talking about supplies. The more supplies you need, the more costly it's going to cost. Also, sometimes during a tear trough procedure, we may decide to add in PRF. Now, PRF is a fancy term for draw your blood, spin it, get the gold part, put it underneath the eye, and it gives a nice golden color to help with the color change and the volume loss combined. So So we will talk about it in another video. Comment if you want me to tell you more about the PRF or PRP injections. But right now I'm just going to focus on the under eye and tear trough fillers. After the 2 weeks follow-up, everybody's happy. If there's adjustments made, there are adjustments made. When do you need to follow up again? I got 2 answers to that. Okay. Well, tear trough fillers do last about a year, sometimes longer, depending on the product used and your metabolism. It's a very, very good idea to see your nurse injector at least twice a year. Not that they're going to be replaced twice a year, but you basically want to just make sure and ensure that everything is functioning properly. You can't go get your tires rotated and balanced without making sure there's air in the tire. You have to have air in the tire and keep going. We don't just focus on one area as an injector. We focus on your overall appearance. So we're looking at your under eye, we're looking at your smile lines, we're looking at your lips, we're looking at the color of your skin. Is it even? And so you definitely want to see your nurse injector at least once or twice a year, just to make sure that you're doing the maintenance things that you need to do to keep yourself from needing surgery towards the seasoned part of our life. Yeah. Anyway, good idea to see your nurse injector once or twice a year. You're getting facials and chemical peels, microneedlings, and all these other things so that it can kind of enhance your look without having to go right into the needles and syringes. So I hope that I answered your questions about the tear trough fillers, and comment if you have any other burning questions about any aesthetics procedures or trends that you have seen that you may have been interested in, but maybe you're scared of, and I will make a video and explain everything all to you. So thank you for tuning in and have a great one.